Hi, many people must be wondering what is an ovarian cyst, the causes of it, the symptoms and the treatment. We will be discussing this today. I am Dr. Deepthi Rahasya, consultant obstetrician and gynecologist, laparoscopic surgeon and cosmetic gynecologist in Srinandaka Fertility Laparoscopy and Laser Center, Kompally. Ovaries are eggs producing organs present two in body for every woman. Ovarian cysts are fluid-filled structures, sometimes with a solid component arising from the ovaries. Many people come to me wondering that the cyst could be malignant, which means it is cancerous. But mind you, majority of the ovarian cysts are benign, which is not cancerous. Women every month ovulate with egg and form a cyst, which is called a follicular cyst. Then after the egg releases, it becomes a corpus luteal cyst, which are completely normal. So every woman forms cyst and the cyst also dissolve on its own. It's a very normal thing. Only when the size increases and the solid component is there and it becomes symptomatic, then we will treat it. Now let's talk about the symptoms of ovarian cyst. Majority of the ovarian cysts are asymptomatic, that means no symptoms at all. But some women may present with menstrual irregularities like infrequent and less periods or more frequent and more bleeding. And some women present with pelvic pain and pain during intercourse. Some of the other symptoms include digestive problems, constipation or diarrhea, and bladder symptoms including frequent urination. Some don't have any symptoms except for the abdominal distension. Like I had a patient the other week, 19-year-old college-going girl, presenting with a huge abdomen. She was thinking it as obesity but diagnosed to be as an ovarian cyst filled with 4 liters of fluid. We have successfully operated on her with 3 ports laparoscopically. The ovaries are made of surface cells, the fibrous tissue and the reproductive cells. Then ovarian cyst can occur from any of the 3 structures. It can be benign or malignant. The ovarian cyst can be classified into 2 categories. 1, the functional cyst, 2, the pathological cyst. Functional cysts are follicular cysts and corpus luteal cysts, which are normal and occur in every woman. They resolve on their own and may require minimal to no treatment at all. The pathological cysts are cystadenomas filled with fluid or mucous material. Second, the endometriotic cyst. It is filled with the uterine tissue growing with every menstrual cycle. Third is the dermoid cyst, filled with other structures like hair, tooth, nails and other bones, is one of its kind. And coming to the fourth, the polycystic ovarian disease, PCOD, is considered to be a cyst itself, but it is a myth. It is a cluster of small follicles in the ovaries, forming the ovary a bigger one and causing subfertility. PCOD is caused by anovulation of the ovary, which means a woman should release egg every month from the ovary. In this case, the egg is not released and collected as a fluid-filled bubble. Over a period of time, the bubbles will grow and make the ovary bigger. Now, let's talk about the methods to diagnose the ovarian cyst. 1. Pelvic examination by a qualified gynecologist gives us a lot of information about the disease. 2. Imaging diagnostics like ultrasound, MRI or CT scan is helpful in differentiating the ovarian cyst. 3. Various blood tests can be done to see if it is a benign or a malignant lesion. 4. Laparoscopy is used to diagnose and also treat in some cases. If you find yourself with any of the mentioned symptoms, please consult your trusted gynecologist to get it evaluated and managed properly. If you like this video, please share, like, subscribe to our channel.